Thank you for staying with us this midday. I'm Sonia Azad. We are continuing our coronavirus 19 coverage because we're seeing numbers building in North Texas. Check this out. The latest is in Wise County, which is west of Denton County, north of Tarrant County, so northwest of a lot of us in Dallas, right? They're experiencing an increase in cases, and that's causing a shortage of beds at Wise Health System. So here to fill us in is Joel Wren, CEO of the Wise Health System. Thank you, Jason, for being here with us.
You're welcome. Thank you for having me.
So give me just a breakdown of what you're seeing and experiencing there for those of us who are not inside the same walls.
Yeah, I want to emphasize that the number of cases that we're having right now is not something that we're not currently able to handle and manage. We are seeing an increase in cases. It's part of what we do now. We have the operations and the policies in place to take care of this, but like all hospitals, we are limited only by the number of beds we have and the number of staff we have to serve the patients in those beds. So as the numbers increase, then there's less beds available, less staff available to take care of not only those patients, but non-COVID patients as well. And we try to isolate our COVID patients on a couple of floors to keep them away from the rest of the population. We're able to, what we call our COVID bubble, we're able to expand or decrease that based on need. And we had been reducing it. Now, as we've seen less willingness in the public to follow the guidelines, we're starting to have to expand it again. And I wrote that letter to the community just because I have noticed as we stop following these guidelines, we're starting to see an increase in cases. We're starting to have to expand that COVID bubble. And while it's still something that we're able to handle right now, what we're trying to do is get ahead of it and make sure that we don't get to a point where we don't have those beds and we don't have enough staff to be able to take care of it, because we're heading in that direction right now.
Can you give me more concrete numbers? Because I don't know, how many beds are you talking about? When you talk about a staff shortage, how many people are you talking about? How many cases are you talking about?
Yeah, so let me give a little brief history real quickly first. We spent probably 2 months after the increase that everybody experienced back in the summer, late June, early July. Once that stabilized, just to give you a feel for it, we spent most of the next couple of months with anywhere from 5 to 7 confirmed positive admitted COVID patients on any given day. That doesn't mean new patients. A couple could be discharged and a couple more can come in. But if you look at our census on any given day, we were typically in that 5 to 7 range. Over the last 2 to 3 weeks, we have started seeing that number increase up to 10, 11, 12. Yesterday, we hit 16, which is the highest number of admitted patients we have had on a single day during the pandemic. Those patients part of them are on our 3rd floor, which is our ICU, if they're the sicker patients. The rest of them we try to keep on our 5th floor. On those floors, we have 6 rooms in our COVID bubble on the 3rd floor. We have some other rooms that can be used as overflow on that floor. And on our 5th floor, it really, again, just varies from day to day. We have been able to reduce those COVID dedicated rooms on the 5th floor, but now we're having to expand it again to keep up with that need. Staffing, COVID patients require a higher level of care. So there's just more staff that is needed to take care of a COVID patient because of all the different things that are involved in that. So as those numbers increase and some of those COVID beds start to fill up, then that pulls staff away from other areas and unable to take care of patients in other areas as they move there. And there's a staffing shortage around the state and around the nation when it comes to nurses. There has been even before the pandemic. It's a profession that is in high demand. We're still playing catch up a little bit from some losses in staff earlier in the pandemic that is combined with the increase in cases that we're seeing and needing those patients to go to have the care that they deserve. And it requires some additional staff to do that. And
Jason, we have seen throughout the last 6 months or so, rural hospital systems really take a hit here. Where are you able to pull from? I'm the health reporter here, so I say this, forget who I am and what I've been talking about with experts for the last 6 months, but it is so confusing for people right now to know what to do and what not to do. So I need you to convince me right now to stop doing some of the things that elected officials are either telling us to do or not to do, despite the things that are open or not open. What are you going to say to me to convince me based on what you're seeing happen in your hospital system?
Well, let me start by saying I empathize with that concern. Yes, there's a lot of information out there, and yes, it's hard to know what to follow and what not to follow. Personally, I've certainly been guilty. I've been to events that maybe I shouldn't have gone to in hindsight. I understand that. And I understand that the numbers do confirm the vast majority of people that get this are going to be okay. They're going to either be asymptomatic or they're going to have mild symptoms and they're going to recover. But I think what I really want people to understand is that some people don't. Some people don't recover and some people get really sick. And when they do, this is where they show up. And we have to have enough beds and enough staff to take care of those people when they do. As I said at the beginning, right now, we're okay, but there's been enough of a surge and increase over the last few days that we're starting to get concerned about that. And so I want to just remind the public that we can all make a difference in that. We can all make a difference in ensuring that as those sickest patients do show up at our doors, that they can have an impact in the things that they do in their daily lives to make sure we have enough beds and enough staff to take care of them. It really shouldn't be an either or on either living our lives and keeping businesses open or protecting each other and protecting our healthcare system. We can do both. We at Wise Health System want us to do both, but we really have to be intentional and mindful about those guidelines and doing just a small part and making a few small personal sacrifices like masks, keeping our gatherings and our events as small as possible, social distancing. And if we do those things, it really will have an impact so that we are able to take care of those sickest patients when they do show up here.
Jason Wren, thank you so much, and we wish all of those folks who are ill in Wise County speedy recovery. Thanks for your time.
Thank you for having me.